Euh, merci d'être toujours là. Alors, la prochaine présentation, c'est celle qui va parler de la machine THERMADAS. Donc, c'est une machine qui va permettre, c'est une radiofréquence endodermique. Et donc, je présente Dr Carlo Bonucelli, qui est chirurgien plastique, qui nous vient de Milan, et qui va nous faire une présentation brève avant de nous faire la démonstration. Donc, je vous demande encore un peu plus d'attention pour la présentation. Alors, la présentation se fera en anglais, donc il faut être très concentré.
Hello everyone, it's a pleasure to be here. Like Amin told us, now we are going to talk a little briefly about the THERMADAS. We know that the demand for aesthetic procedure is constantly growing, and we can usually achieve good results with most of the injectable. The real problem is when we have to face the skin laxity. We know that the retidectomy is still the gold standard, but for the people that don't want to undergo any type of surgery, the answer could be the THERMADAS. The THERMADAS is a device that combines two different technology. The Dasproplasma, so the plasma that works well on the superficial layer of the skin, and it could be used not only for the benign skin lesion, but also to treat some signs of the aging. But in particular, today we are going to focus on the ENDODERMIQUE. The ENDODERMIQUE is a technology that allow to produce the energy directly inside the subcutaneous tissues. So to achieve an increase in the temperature and at the end a skin tightening and a partial lipolysis of the fat. The ENDODERMIQUE in particular, it radiates electromagnetic wave that produce a controlled rise inside the temperature. The rise in the temperature at the end results in a contraction of the collagen fiber and a stimulation of the fibroblast activity, so neocollagenogenesis, and an increase in the dermic density. At the end, it produces like a lift effect. So we can achieve a skin tightening, a skin rejuvenation with also an improvement of the quality and the texture of the skin, and it also produces a mild fat lipolysis with the highest temperature. It's a wonderful type of treatment for different type of patients, for the younger generation that just want to refresh a little bit the look, for the older people that have a mild skin laxity that doesn't want to undergo any surgery, or the people that already underwent, for example, after a retidectomy, but through the passing of time, the result begin to lose some of efficacy. Also, it can be used on the dermatological patient, like for example, for treating acne, and also on men. But how it works? The device has a cannula of 7.5 centimeter long, of 20 gauge, that is insulated except for the tip of the cannula. The tip of the cannula does two different things. It constantly sends the temperature inside the tissues and sends back this information to the device. The device, accordingly to the temperature sensed, emits the energy, so to achieve the end point of the thermal endpoint that we want to achieve inside the tissues. So we insert the cannula directly inside the subcutaneous tissues and we emit the energy. There is a small video that shows how a normal treatment could be done. No, it doesn't. Sorry, it doesn't work. I'll show you just an increase of the temperature on the surface of the skin. Consider that inside the tissues we can achieve 57 degrees, and on the surface we only achieve the 42 degrees. The procedure can also be combined with different type other treatment. Maybe also in the same session from the same entry point of the cannula. We can inject hyaluronic acid. We can use suspension treat to send the patient out of our cabinet with a wonderful result. We can also combine it with a different skin booster, or now that is on the rise with different product of regenerative medicine. In particular, to cover the gap that goes from the treatment itself to the last results that we are gonna see in the next period after the treatment. What are the different benefits? First of all, the low invasiveness and the low trauma. Thanks to the rounded trip of the cannula and the only entry point that we do on the face of the patient, the treatment is usually well tolerated. There is a low learning curve for doctor, okay, because the device is you can say it can be used in a simple way, in particular with a lower temperature. And also we have a better patient management, because we can decide a custom tailored type of treatment. We can decide how many lines we treat, and so we can decide how much time spent on a single patient. There are different type of application. The first is it's called like the Endo Easy. It's the target is the patient that has a mild to moderate laxity of the skin. In this type of patient, we just do a little bit of anesthesia at the entry point of the cannula. Then we draw to 3 to 5 line, and we are gonna spend just like 3 minutes for line. We insert the cannula and we withdraw it just every 20-30 seconds. We withdraw 1 centimeter of the cannula, so to achieve a temperature of 49 to 53 degrees. There is a small video. I hope this one work. No, I don't know why. Not there were the video. There. Okay. This is the easy treatment. You see the treatment begin with a drawing of the line that we're going to treat during it. A small injection only at the entry point. The creation of the entry point with an 18 gauge in this case. And then to insert the cannula in subcutaneous tissues. We put the cannula until we reach the end of each line. Then we begin to emit the energy and to withdraw the cannula. You see the temperature is rising inside the tissues. And you can see where is the cannula. It's in this point. And this is the easy type of treatment. There is also an EndoPro type of treatment that is more targeted for the people that has less subcutaneous fat and has more firm and compact tissues. In this case, we do a little bit of anesthesia all along the line of the treatment. We draw the line, and then we begin to emit the energy just during all the treatment. We begin with slow movement, and then we increase the speed of the movement of the cannula. This helps to separate at the beginning the tissues. So we do like some type of dissection of the tissues, and then we also use higher energy to achieve greater results. In this video, you see just for the little bit of anesthesia in all the area along the line. Then, after that, just like a normal cannula for the filler, it could be used. And then, after that, we begin with the slow movement of the cannula, just to separate the tissues. And after that, at the end of the second phase of the treatment, where we increase a little bit the quickness of the movement of the cannula, just to dissect more all the planes. And finally, the endolipo, where we usually treat the subcutaneous fat in the submental area. It's a type of treatment that can be easily do also inside a cabinet. So the treatment begins with infiltration of all the submental area with a Klein solution. Then the area is treated with the highest temperature to help to melt the fat, and after the temperature, our endpoint temperature is reached, we begin to suction with a vacuum syringe. Okay, this is the phase of infiltration with the Klein solution. It's a normal Klein solution. For 1 liter of saline, I usually use 1 milligram of epinephrine and 800 milligram of lidocaine in 1 liter of solution. And after that, after the treatment with the cannula, I pass with the vacuum syringe just to remove a little bit more the fat. Immediately after the treatment, you can aspirate just 10 ml, 20 ml of fat from this area, not more usually. And this is a picture of the patient immediately after the treatment. I am going to show you some before and after of all the areas. In this case, was treated all the area of the cheek, and after 1 week you can see more the improvement of the quality of the skin and the tightening, a little bit of tightening, just with lower temperature because the patient was a little bit sensitive, so we decided to treat it with a lower temperature. In this case, was treated the submental area. You can see after 2 months with higher temperature, the retraction of the skin. In fact, in the first picture, you can't see all the platysma band, but in the second one, you can see them well. Another patient that in this case was treated only in the jowl area. You see the area that is drawn in red, and after 3 months of the treatment, all the area was truly reduced in terms of fat. A patient that was treated still in the submental area and on the jawline, you can see an improvement in both of them, and also on the lateral picture. A patient that was treated along the Venus necklace, every single line was treated just to produce a contraction of the skin. A patient that was treated in the upper eyelid, we can see that before how is more evident the quantity of skin, and after 7 months after the treatment, the reduction on the quantity of the skin of the area. A patient that was still treated in the submental area, before and after 3 months, you see also an improvement in the cervicomental angle, that was truly important, and also in this picture. Also, you can try to treat area of the body, for example, the knees that are usually difficult to treat. You can see an improvement in the quality, in particular, of the skin, and reduction of the creepiness of the skin just after 1 treatment. Another patient was treated in the same area. A patient that was treated still in the jawline and also on the cheek. Immediately after the intralifting session, it produces, in fact, a good contraction of the area. Patient that, in this case, was treated for a better jawline definition. And these are some other cases of submental area. You see the reduction in this picture. And also the improvement of the quality of the skin is one of the most evident type of results. Another patient. And just a briefly explanation about the plasma. The plasma, you know, probably ideally the technology of the plasma can be used for the different dermatological problem. We know that the plasma is the 4th state of matter that is produced by the ionization of the gas. In this case, the gas is represented by the air. So how it works? thanks to the ionization of the air, the air itself become a conductor for the plasma spark. The plasma spark reach the surface of the skin where it is charged at the temperature of 2000 degrees. So at the end it produces an immediate sublimation of the skin without causing any major thermal damage, because we pass through a solid directly to a gaseous state. What are the different benefits? The different benefits are similar to the one of the CO2 laser, that ranges from the stimulation and contraction of elastic fiber, fibroblast proliferation, collagen fiber stimulation, and so on. Also disinfection, coagulation. It has two different two different features. An easy mode where we need to choose only the type of treatment and the phototype of the patient, and an advanced mode where you can choose from 10 different power and 10 different frequency. The most important feature of this type of device is the possibility to choose the frequency, so to reduce the risk of dyschromia in the higher phototype. These are some treatment, in this case in the prolabial area. I can see. Okay, so type of treatment for the there are also some different studies that show how it was safe, this type of treatment, in particular one with a confocal microscopy that showed that after 1 month, no type of signs of coarse collagen or residual scar was found in the treated area. And also another very interesting is about on the result of treatment on xanthelasma. So after 3 months after the treatment, no sign of scar, coarse collagen, or inflammation of the area. And also there are some studies that showed its efficacy in terms of non-surgical blepharoplasty. There is also here some bibliography if you are interested. And just a couple of before and after. This was an asymmetry. Just 3 weeks after the treatment, we can see there is still a little bit of redness that is normal. A patient that was treated just with 1 session, you see the improvement in the quantity of the skin, and also another one that with the closed eyes, just to show the improvement, but not only in terms of reduction of quantity of skin, but also in terms of improvement of quality of the skin. So thank you, everyone.